The most common form of dementia is Alzheimer's disease. The sad reality is that current projections show that about 16 million Americans are going to have this disease by 2050. There are a variety of pathophysiologic changes that cause these, which we're not going to get into, but I want to talk about the recent data that came forth regarding the use of erectile dysfunction medication for Alzheimer's disease. And it's important to note that correlation and causation are separate things. One doesn't necessarily ensure the other. The data that we'll get into in a minute show that there is perhaps a decreased risk of Alzheimer's disease for men who are using Viagra. Viagra, also known as sildenafil or Revasio, is approved in the United States for treatment of pulmonary hypertension and erectile sexual dysfunction. It works through a variety of processes, but primarily through nitric oxide release, which is a method of increased blood flow. The recent data regarding this drug and dementia was done by Dr. Chang at the Cleveland Clinic, and they used a computer method to basically look sort of backwards at a variety of data. And what they found is that for those who were using sildenafil, or generic Viagra, or Viagra, if you will, that the risk of developing dementia could go down significantly. And it's important to note that this is an association between sildenafil and the reduced risk of Alzheimer's dementia, but it hasn't shown, based on their data, that sildenafil actually prevents or reverses Alzheimer's dementia. There can be other things at play here. Obviously, there's a variety of factors. Current drugs focus on treating either the symptoms, trying to improve some of the neurologic and memory symptoms. Others are designed to hopefully alter the progress or progression of the disease itself. And unfortunately, haven't really had a huge amount of success for that. But the bottom line is that when they looked at data from 7 million Americans, they found that most of the people, mostly men in their study, were 69% less likely to develop Alzheimer's over 6 years than those who did not take the drug. You might wonder why their data shows mostly men. Well, keep in mind that this is also used for pulmonary hypertension, which is high blood pressure in the blood vessels going into the lungs and creates significant detriment to overall function, breathlessness, decreased exertional capacity, and a variety of things. And those patients can be men or women both. So that's why there's the data that points to both men and women in this study, at least anyway. So keep that in mind. I'll be much more interested to see how this plays out in years to come and as other studies are developed to further test this hypothesis. So hope you found that helpful. As always, this is educational information. I'm not suggesting that anybody take any substance. You need to talk to your personal physician or neurologist. When formulating this, I got this question a lot this past week, and so I thought I should share a brief video on this topic.